And what was very, very clear for us, we were told the COVID did not have any cure, but the cure number one for COVID was oxygen. So we purposed to put oxygen plants in all our level 5 hospitals. Those are the 3 hospitals, together with Tigoni. So as we talk, Tigoni has an oxygen tank of a capacity of 3 tons, and this was piped direct to the wards, so that a patient could just get into the ward, and if you need oxygen, all you need to do is to pull. And I can tell you that that is what has assisted us up to today. Currently, we are spending about 30,000 shillings per day per patient. Get that right. Every COVID patient who is in our facility is actually spending 30,000 shillings per day. Largely because, as I said, 90% of them are on oxygen. And when you talk about oxygen, most of the patients are consuming about 15 liters per minute. So the 3 ton that we are talking about in Tigoni, oxygen tank, is being filled in every 48 hours. So if you can just do a quick calculation, that the average hospital stay for a COVID patient is 21 days. So for the 21 days, we are spending in excess of 600,000 shillings, 0.6 of a million, for one patient who has remained with us for 21 days. Remember, we are not charging COVID patients. All our COVID patients will walk in, they will be treated, they will leave the hospital, and they will not pay a penny for the 21 days. Now, unfortunately, this money was not budgeted for, and therefore we have to pull this money from other sources. So we pull from roads, we pull from water, we pull from agriculture and other areas that then suffer in the process. Now, during the first wave, when there was lockdown, a lot of people found themselves with products that they could not sell. You probably had 3,000 chicken laying eggs, and all of a sudden there is no market for eggs. Or you had 5,000 poultry which is ready for slaughter. But unfortunately, the hotels are closed, the eating places are closed. So a lot of people lost their lifelong earnings. They lost that business completely. But then, of course, with several help and savings from families and some support here and there, they came back. And the second wave did not hit them as much. Remember, we did not have a serious lockdown in the second wave. But then the third wave came, and we are now one of the 5 disease-infected counties. And this lockdown, again, has found those people who are just about to recover with products that they cannot sell. Your cow is still producing milk, and you are selling in establishments around Kiambu or in Nairobi. A lot of our people hawk milk in Nairobi. It's no secret, but they have found themselves without market, and now that has had a devastating blow to the livelihood of our people. So we are still trying in various ways on how we can help them. I think first is to say that it is planting season, and therefore we are now distributing seed and fertilizer worth about 50 million, so that at least they can have a crop, something to produce over the next 3 months.